For the last 2 years, the COVID pandemic has a profound effect on mental and physical well-being of all of us, including smokers. So, a recent study published in Lancet this April 2022, which is a meta-analysis of various studies published across the globe in the last 2 years, summarizes that overall, if you see, then the during COVID pandemic, the smoking prevalence actually decreased little bit overall, and there are certain attributable factors to this. Most of the time it is the fear of getting COVID, fear of getting a severe COVID and with a adverse outcome, and also increased health awareness in population in general has led to decrease in smoking prevalence across the globe. COVID pandemic can increase smoking also because of the boredom, lockdown measures, increased level of anxiety, stress can also attribute to increase in smoking. But largely this is seen in the subset of patients who are persons who are already smoker. So in the same Lancet study which I was quoting, 21% of smokers actually decreased smoking during the pandemic, but 27% of smokers actually increased their smoking. So suppose they were smoking around 3 to 5 cigarettes, so they increased to 5 to 7 cigarettes during the pandemic, which highlights these things. Also, 4% of smokers actually quit their smoking during the pandemic for good. Many youngsters nowadays, if you see, because of peer pressure and also work from home environment where the inhibitions are less, they have gone to get a new smoking habit. So in the same Lancet study, 2% of persons who were never smokers actually started smoking during the COVID pandemic.
In youngsters, there seems to be an increase in the smoking, especially in the urban areas, and there is also a small trend of increasing in smoking among youngsters in women in the urban belt. Whereas in the rural belt, what we are seeing is that there is also a trend towards women using chewing tobacco. One of the key steps that need to be taken up by healthcare organizations, governments, and medical fraternity is to increase the assistance towards quitting tobacco. And while we focus on awareness related activities, the government should also equally focus on enforcement of the COTPA amendment as well as the COTPA existing rules in hotels, bars, clubs, and all public places, so that we create more smoke-free environment and a smoke-free youth generation.